Good afternoon, everyone. Thanks so much for joining us. My name is Joe Egger, and I am Associate Professor of Global Health here at the Global Health Institute. I am also Director of our Masters of Science in Global Health program. It is my great pleasure and privilege to welcome you today to our Admitted Students Day. I'm so excited you were able to join us today. Housekeeping, we are recording this session for those of you who are unable to attend, or for those of you who want to watch this again later. And I will post this recording on the Admitted Students webpage after we're done today. This is a very exciting time of the year for all of us at DGHI because we have the opportunity to review all of your stellar applications for admission into our program. All of these students from many different backgrounds and cultures and lived experiences from around the world. Our program is truly global, and I hope that in the next hour or so as we talk, you will see just how unique and exciting a program of study our Masters of Global Health degree is. I'm sure that many of you are considering other programs of study. If you choose to come to Duke, you can expect to have an experience that we believe is unlike any that you will find at other institutions. Duke is a really special place. There are many things that I think set Duke and DGHI, and by DGHI I mean the Duke Global Health Institute, that set DGHI apart. But let me just list a few here that come to mind for me. First, we have a deeply committed and experienced faculty. You'll have the chance to meet several of these faculty and ask them questions in a few minutes. But let me just say here that all of our faculty come to Global Health with a strong and deep intentionality to make health and healthcare more accessible and equitable around the world. Our faculty come to Global Health with a sense of social justice and a desire to help train the next generation of global health leaders like yourselves. That's the first. The second, I think, is the diversity of our student population is, I think, probably our greatest asset, or certainly up there. That diversity can and is defined in many ways. It can be defined geographically, socioeconomically, by gender identification or race ethnicity. Regardless of how it's defined, we believe that this diversity of perspective and lived experience that you, our students, bring to our program greatly improves the learning and intellectual development of all students in our program. Just as a personal anecdote, I was having a beer with one of our second-year students last week. He was my TA for my EPI class last year, and we were talking, and he said, "Joe, can I ask you a question?" And I said, "Sure." And he said, how do you guys do it? How do you guys put together a cohort of students that really gel together so well?" And I said, how do you mean exactly? And he said, "Well, I was talking to some students the other day, and we all sort of agreed that we recognize that we have, curricular achievements where we're strong students, but it seems like when you think about the class in general, that you guys are not just selecting the top students in terms of grades, but you're choosing a cohort of students holistically that get along together, that are learning from each other from different perspectives." And I said, "Well, thank you very much. I don't know how we do it, but I can tell you that we work really hard to do that." And so I'm glad you appreciate that. This time of the year is a really busy time for us, right? We are reviewing all of your applications, and as we go through them, we are very intentionally trying to put together a class of students who not only are very strong scholastically and have great experience, but come together as a group from lots of different backgrounds so you all can learn from each other. Third, we believe really strongly here in allowing you opportunities for cross-cultural experiences. This is primarily in the form of your summer field placement you've probably heard about already, but these cross-cultural experiences are not just part of that field placement, but are quite important to us throughout your education. Fourth, DGHI is highly interdisciplinary, and that's a term that's thrown around a lot by a lot of people. So let me explain what that means to me. The Duke Global Health Institute is an institute. It's a Payne University institute. It's not a school of public health. What this means is that we draw on faculty from across Duke. We have faculty from humanities and economics, engineering, biomedical, health sciences, clinical health, you name it, we have it at the Institute. We believe that this creates a wonderful opportunity. All of us are together. A lot of us are in Trent Hall. I can walk down the hallways of my office here in Trent Hall and different floors, and I can come across other epidemiologists like myself, but also health economists and clinicians and engineers and statisticians and a lot of other areas as well. This creates a culture that we think is unique and exceptional. And finally, important to me, we believe in training you to be highly competent researchers and practitioners of global health. This may sound obvious, but it's really important to us. 2023 is my 10th year at Duke, and I have mentored many graduate students since I came to Duke. All of my students have published at least one peer-reviewed article related to their own research during the course of their study. And this is not me bragging. This is not unique to me. This is the norm at DGHI for our students. And the level and the strength of our research training is something that we are very proud of. All right, so that's kind of my top 5 list of things that are important to me that I share with you about the Institute. In a moment, I'm going to introduce our faculty panelists or ask them to introduce themselves. But before I do that, I want to turn the table a little bit and have you learn a little bit about yourselves or our prospective students. So Alexis, if you can go ahead and share that demographic slide. I need to increase my size here. Okay, so hopefully you can see that on your screen. So these are the students who have been admitted to our program. You can see really strong GPAs there. As we said, we're certainly interested in scholastics, but other things as well. Before I go on, let me just take the opportunity to invite you, the students, to go ahead and, if you don't mind, introducing yourself to us through the chat. So if you can just perhaps put your name or where you're from or some other little tidbit fact, what kind of things you might be interested in, anything to kind of introduce yourselves to all of us, that would be great. Okay, so 8 of you are first-generation college students, 14 first-generation graduate students. You bring a wide variety of academic and personal perspectives. We have 44 different undergraduate institutions among applicants, 30 unique undergrad majors among applicants. We're a very international place. This is the norm around here. 59% of applicants are international. 41% of applicants are from the US, and we have 16 different countries represented among the applicants. And as is fairly common these days in global health, about 80% of our applicants are women, 20% being men, and our average age is 24 years old. All right, great. So now let's switch gears, and I'm going to ask faculty our panelists to join us here and introduce themselves. Catherine, you're the first one on my screen. Can I start with you and ask you just to briefly introduce yourself?
Sure. Good afternoon, everyone. I'm Catherine Staten. I'm an emergency medicine clinician and physician here at Duke. And in my spare time, I do work in the emergency department, but most of my time, about 75% of my time, I do implementation science research, focusing on improving access to care for injury acute care processes. So injury care, emergency care, those kind of things. I work both in the hospital globally, but also out of the hospital using data analytics to improve our understanding of the challenges of accessing care. All of that, what does that mean? I get to do some really fun research with partners that I like in multidisciplinary teams. and lead the Gemini Research Center, which is Global Emergency Medicine Innovation and Implementation Research Science Lab. I get to teach courses within our institute. So I currently teach the Systematic Review course, our Implementation Science course, and a grant writing course that happens in the fall. And I'm happy to mentor some of the learners that have come through. It's been a great opportunity to go from being a master's student at DJHI myself a little over a decade ago, even though I won't admit that again, to now being a mentor in the program.
Thanks, Catherine. That was great. Asandu?
Thanks, Joe. Good afternoon and good evening to everyone. My name is Asandu Obuoji. I am an assistant research professor at the Duke Global Health Institute and also faculty, an assistant professor at the Duke School of Medicine, Population Health. My background is in medicine. I was trained as a physician from Nigeria. And but what I do now is not patient care. I do research on health economics and health systems. And my research essentially focuses on trying to make health systems work better for historically disadvantaged populations, especially the poor. And we have at our center here, which is the Duke Center for Policy Impacting Global Health at DJHI, we have several projects around the world, mostly in Southeast Asia and Africa. So looking forward to interacting with you all and happy to answer any questions that you have.
Thanks, Asandu. Liz.
Hi, afternoon and evening, everybody. So my name is Liz Turner. You can probably hear I'm from England. I have, like Joe, been here for just biostatistician. So I would engage with you as the instructor of the first course, the combined course in biostatistics and epidemiology in the fall. So you would see lots of me twice a week. I also wear the hat at DGHI of directing our group called the Research Design and Analysis course. So this is something we'll circle back to later in the discussion today, but this is a group of epidemiologists, statisticians, and other kinds of methodologists who are available to partner with you and the faculty members you'll work with on research and practice projects. So that's a really super resource at DGHI. We similarly work on a host of different faculty research projects. I primarily work in malaria in East Africa and global mental health in Asia and also in East Africa, and primarily using complex study designs used to evaluate through randomized trials a host of different kinds of interventions targeted particularly at malaria and global mental health. Over to Joe. Great.
Thanks, Liz.
Looking forward to hearing more from you all.
And Eric, where are you on? I don't see you on Zoom, but I know you're there somewhere.
I am. Hi, Joe.
Great.
Hi, everybody. Eric Green. I'm a psychologist by training, and I'm a core faculty member in the Institute and teach, like Liz, you'd be with me twice a week in the fall, learning about research, design, and methods. My interests are usually somewhere around data and data science and digital health. I've worked with nonprofits. I've worked in industry, and I also teach a data science course as well. So I try to bring all those perspectives into class, and look forward to meeting some of you in the fall. And I'm watching the chat and checking the men's basketball bracket. I see we have Princeton still in the tournament, which is great. So I'm keeping an eye on this.
Thanks, Eric. Yeah, and the chat, I really appreciate everybody putting in information in the chat. It's really great to see people from really all over the world represented here today. This is a terrific group. Wonderful. Thank you, panelists. And again, I really appreciate your time today being with us to share your thoughts. I'm now going to move to some questions, and I will keep them fairly open to any of our panelists to answer. But I may poke and prod here and there. I'm going to start out with kind of a general question, which is, what is your teaching style? And given the fact that I said DGHI is big on interdisciplinarity, What are some of the tools that you use to try to build teams or teamwork in some of your classes? So Liz, perhaps we could start with you if you don't mind.
I'd be happy to. Yeah. So as you may recall, I just mentioned everyone, I teach the intro biostatistics and epidemiology class. So in that class, we recognize that you're coming from a host of different backgrounds. I mean, and that's really, as Joe, I'd also like to reiterate what Joe said, a real strength of the program and the cohorts that come through our program. So what we do, it's entirely not random. It's very intentional. We place you in teams of 5 to 6 people who are very diverse in background. So that be kind of undergraduate degree or training that you've received beyond undergraduate, the extent of your epidemiology and statistical training. And so that means that you're going to be with people who come with many different perspectives to kind of learning and discussing and deepening their knowledge of biostatistics and epidemiology. So again, assuming only minimal foundations in both of those 2 areas. And then those teams, you remain in those teams for the whole course of the semester. So you meet with me twice a week. We have lectures and then intersperse that with team activities and questions for you to reflect on, some of which you would have seen before class, some that we'll bring during class, so that you have this opportunity to see how your team works, how we, that's how we all address questions in global health, as working in interdisciplinary teams. And so we're trying to immediately, as soon as you come in the first week, start that process, get practice in it. All of us learn from each other as to how we can kind of work better on these kinds of teams, and at the same time support each other in learning the content. And in my mind, I mean, I've now will have taught the class for 10 years. Every single year, I learn so many new perspectives on how to think about the content and ways in which I can try to present things from different perspectives. And you all facilitate that in being in those interdisciplinary teams. Yeah.
That's so great, Liz. Thank you. I'm just going to add a couple of things there for myself. As I mentioned, I teach epidemiology. I teach more of an advanced epidemiology course to second-year master's students and then other graduate students at Duke who want to take the class. And our class is really about trying to get you to think about designing your own epidemiologic studies. And so what I do a little bit different. I don't put people in teams for the whole semester. I allow you to sort of mix as the semester goes on, but I usually, in terms of style, I usually try to have a short lecture each class that it's not just me kind of droning on the whole class period. And then I try to break you up into teams to answer questions or to design the study that we're particularly talking about that day. I also try to pair people up. I do a technique called Think, Pair, Share that I like a lot, which is teams of 2, but get students to interact with each other around a particular question more. So I'll ask a question if I think it's a particularly hard question or the class is kind of quiet. I'll have you think about the question and then pair up and talk about an answer with your classmate or classmates, and then share back your answer to the class. So that's a technique that I like as well. Liz, is your hand up?
Yeah, it is. I think this is an important addition to what I described as well, that the intention with the teams is not to add additional work outside of class. So I don't expect you to do teamwork outside of class. I would encourage you to work with your teams or other colleagues, but I just want to clarify that the team time is during class so that you're not having to organize yourself outside of class, and everything you'll receive immediate feedback on the problems you're working on during class so that you don't have to leave and wait for different follow-up feedback that's very kind of immediate and kind of builds over the course of the semester. Yeah.
Thanks, I appreciate that. Eric, perhaps we could turn to you. I was hoping you could talk to us a little bit about how you work with students who might need a bit of extra support to master course materials in your class.
Yeah, that's great. So our courses have teaching assistants who are former students who've been through the course. They're a great first point of contact. I think the pandemic has made it easier than ever for learners to get support by attending office hours, either in person or via Zoom. Now, that's very common. It wasn't as much before the pandemic. I don't know if many of my colleagues offered a remote option for office hours, but biggest barrier to sometimes getting help is just not feeling like, oh, I'm going to go into their office. And you're welcome to, but we also offer Zoom office hours, and mine are just scheduled on demand. And a lot of students like to meet before or after class, in either kind of catch us right before, right after, or schedule coffee or lunch. And I don't know, I think I'm like most of my colleagues in trying to meet you wherever you are. The first semester is a little bit of a ride, trying to get used to, for some of you, being back in school after a long time. And I think all the faculty are aware of that. So we're looking out for students who might need the help before they ask for it.
That's great. Thanks, Eric. Does anybody else want to add on the panel, want to add anything to that?
Yeah, maybe a small note, everyone, that over the years we've had requests for some kind of materials for biostats and epi to be released earlier over the summer. So we have a kind of welcome package. We don't expect you to go through it. Welcome to biostats and epi. But it allows you a little bit of lead time to kind of take a look at some of the materials for the first few weeks, if you'd even just like to kind of get a sense of the arc of where we're going with those materials, because we use an open access textbook that would be freely available to you. And we use open access, an open access programming language, the R programming language that some of you may know of. And if you've never programmed in your life, don't fear. We take it step by step, and you have a dedicated lab to tackle that. Yeah, together with the TAs, who every year are phenomenal. Yeah.
I think that's a really important point. Some students come into the program thinking, I don't have a stats or quant background. I haven't taken a math class in a long time. I'm going to be totally lost. And we are aware of that. Again, that's part of our program to bring in students from the humanities and other fields that you might not think are traditional for a global health pathway. So we certainly understand that, and we'll get you up to speed quickly.
Yeah, and to add, and I will stop talking, that for those of you who are very experienced in biostatistics and epi, we also have your needs in mind and ways in which we can challenge and you to think differently, to have different perspectives. And that's greatly achieved by working in the teams as well. Yeah.
Sure. Thanks, Liz. Asandhu, perhaps we can go to you next. Can I ask you, how do you include the perspectives of other faculty and global health experts into your courses?
Sure, thanks, Joe. So I teach a class called Health Systems in lower middle income countries. I also teach another class, which is a BAS Connections project for interactive mentored research for students. And the focus of that class is universal health coverage for universal health coverage financing in lower middle income countries. And so in this class, by definition, I cannot cover the whole world, right? So the lower middle income countries. So some of the things that we do to incorporate other thought leaders will include bringing some of them for guest lectures. We used to do in-person guest lectures before. We still do that if the person is close by, but in the post-COVID era, Zoom makes it easy. So we bring guest lectures from places like the World Bank, Africa CDC, IADB, and other institutions, WHO as well, to share their perspective. We also bring in policymakers from the different countries where we work. So we also get the in-country experience and the flavor perspectives from in-country actors. The class that I teach is structured around case studies. And these case studies encourage immersive learning such that the students are now able to put themselves in the position of the protagonist of that case and think through decisions that they will make or they would have made if they were facing the same challenges. And so we typically do 6 case studies, 2 case studies from Latin America, 2 from Africa, 2 from Southeast Asia. So that way we also get a diversity of perspectives and also get different country experiences. And we also provide readings, a variety of readings. Typically, if we're dealing with a question that's related to a core health system function, for example, health financing or access to medicines, we will provide readings that range from maybe the first time WHO decided to codify that building block, which is maybe 20, 30 years ago, but we will also provide a few readings that are more recent. So that way there's a flavor, there's a way for you to get both the core and how things have changed over time. We typically also have them as required versus optional. And the last thing that we do to incorporate perspectives of other professionals is active networking. So I tell the students after every class, if anyone is interested in digging deeper into that particular topic or wants to explore that for their thesis, I always offer to connect them with other experts in the field that might be able to help them think a little bit more about that. So those are some of the ways that we incorporate the perspectives of other professionals and experts around the world into the work that we do.
Thank you, Asandu. Can I put you on the spot? You mentioned Basque Connections, and I know Lisa has just put a link to Basque Connections in the chat, but I was wondering if you could just briefly explain what Basque Connections is, because I think that's a really wonderful resource and program that is unique to Duke.
Yeah, sure, I can do that. So Basque Connections is, I think I agree, it's an innovative, interesting program. And here at Duke, what it allows students to do is to be part of a team, usually an interdisciplinary team, and also a multi-departmental team. So you have students from different departments, you also have students from different levels. So you have undergrad, master's, and PhD. And you have postdocs, you have faculty. So the idea is to help students walk through the whole process of conducting research, being that a lot of the things that students do while on campus is learn about methods, learn about new skills. So this is an opportunity to be part of a team that goes end to end in designing a question and executing on that research project all the way to publication. Or sometimes it's a project that has a different deliverable, such as a dashboard that will be externally facing for a client or for any consumer of that kind of information. So the idea will be to make students work with faculty to do that. That happens every year. This is the second year that we've got this Basque Connections renewed. Students also have the opportunity to present their work through the Basque Connections, both here on campus at Duke during the Basque Connections Fair. Lots of Basque Connections students have published abstracts and posters and have showed them. They've also, students have submitted abstracts to conferences outside Duke and being funded to travel. On our own Basque Connections, we have some students who will be traveling to go do a presentation. We also did another one Basque Connections before to support a Lancet Commission on investment in hearing healthcare. So there are really cool opportunities for you to do research. And I think Lisa just put a link in the chat. You could look at that and see the previous projects. Easy way to look at it, I assume all of you are interested in global health. You could just filter by the global health tab, and you'll see all the previous projects. And it's open to everyone. You can apply and then you select a team. There's a match that happens. Yeah.
That's great. Thank you, Asandu. I was involved with one a few years ago, and it was a wonderful experience I was on. entrepreneurship in global health. And I know a number of the other panelists here have also been involved in BASS. So that's great. Thank you. All right, I'm going to open up the next question to a number of you, but Catherine, perhaps we could start with you. In your view, what are the key strengths of the Masters of Science of Global Health program for you?
Yeah, thank you, Joe. Great question. So as I'm going to say a primary clinician, I did go through the program, but my stat skills are not on the stronger side, I'll put it that way. As a primary clinician, I love the multidisciplinary team components of global health. And that all started from our master's program because we were all so different in our strengths. And so to bring together this multidisciplinary, even background that we have with then multidisciplinary faculty, I think it's pretty amazing. I think that's also seen through the curriculum, how the curriculum itself is very flexible and you can choose what you want for your goals as you develop. Similarly, it's very didactic in origin, meaning there are skills we just need to know as global health researchers. And there's been a real focus on trying to make sure that we understand and can use those skills in real life, creating classes where you, like Asandhu was saying, talk to the leaders in the field, think the way that we need to think in global health and actually do the work of global health from a master's level learning perspective, I think is just very, very unique. And so I think that those bring a really team-based approach, allowing us to innovate as well as collect the didactic and skills that we need to achieve. And it also teaches some of the softer skills that you need in life, like the leadership skills, the networking skills, communication skills. So the curriculum itself, I think, is built to establish you as up-and-coming faculty and leaders in global health, because it also gives you the understanding of creating your own path. Because I think that flexibility is so important.
Thank you, Catherine. Do other panelists want to share their thoughts on that question? Strengths of the program for you?
No, Joe, but only because I think I'd repeat a lot of what Catherine.
Yeah.
Well said.
Yeah, very well said. And I'd say as well, through the kind of methodological focus in the early kind of part of the curriculum, we also fully recognize we're not, our goal is not to train you to be kind of an expert statistician, for example. It's to have the tools and the language to partner with, say, a faculty statistician like me, so that we can design studies together to address really important questions, and that we have an ability to communicate in a really effective way. So that thread comes through all of our methodological classes, so that you can become really conversant in lots of methodologies and recognizing each person's limitations with those and how we can kind of function effectively together towards a common goal, whether it be research, practice, otherwise. Yeah.
And I'll just add as well to what Lise just said, that you also have the option to either do like core research or do a practice track. So for those of you who don't see yourself doing a lot of research, or see yourself in the role of an intelligent consumer of research, or directing some research where you don't have to get your hands on the day-to-day, there is a practice track that you can also choose. So I think that that's a unique strength of this program, that is flexible enough to meet some of the needs that you may have, and those needs change, right? So the program allows you to do that, gives you some time to choose and before you commit.
Thank you, Asandhu. Okay, I'm going to move on to the next question. This is, perhaps Catherine, we'll go back to you if you don't mind. What advice do you have for students as they work to refine their goals for the program as it relates to research or their internship pathway? So essentially what Asandhu was just talking about is you have this kind of, decision to make about kind of the directions you're going. How would you say you give advice to students to sort of help them think through these decisions?
Yeah, so one of my leadership positions, it's termed strategy. You just get to sit around and think and come up with a strategy of how to do things, and it's so much fun. I think that's what we have to start thinking about at the phase that we're at right now. Is you're about to start your master's degree. To get the most out of it, you have to think about what you want to get out of it and start to assemble sort of, this is what I need, this is why I want it, this is how I want to get it, because this is what I want to do. Because the steps to get to the next couple of steps of whatever that is, you sort of have to start to delineate them and understand what it means to get there. So personally, I sit down with all of our students and we say, okay, what are you gonna do when you grow up? And why do you want to do that? And why does that make you happy? And how can we get you there? What are the skills that you need? What are the projects you want to work on? What are you interested in? And it feels like an interview all over again, but we're trying to think about the specific areas where we can supplement those learning opportunities in any way that we have possible, whatever is available. So as you start to think about why this program, why this process, there's so many opportunities, and sometimes that could be overwhelming, but really think about what you love doing, what your passion is, and why you want to do that. And then the path becomes a lot more clear. If you smile as you think about it, as you can see I do all the time, then that's the right path. That's the way you should be going. And then you constantly have to reassess and rethink and think about what you need to get to the next couple of steps, whether it's more analytical component and asking Liz for help there, or whether it's coming into a clinical area and really understanding sort of the implications of the work or how to implement something.
Thank you. Sandhu, do you want to add anything to that?
Yeah, just say that it'll also be good to have a clear alignment between what you, in addition to what Catherine said about what you want to be doing afterwards. I think thinking about how much work you will need to put into today to get to where you want to be, because those two tracks are slightly different and they're set up for different goals. So if you think you want to do a graduate degree in the future, a PhD or another master's and all, you might be thinking more about the research track, because getting a paper or getting some of those skills will be a big one for you, a big advantage for you going into that application. If you're thinking more about going back into the industry, working with NGOs, multilaterals, UNICEF and others, and you don't see yourself doing hands-on research, but doing more policy analysis, taking on leadership roles, working as a practitioner, then you might want to do the internship track. So being a little bit deliberate about what you need to do today to get to where you want to get to tomorrow, I think is important. Of course, you also need to, when I talk to my students, if it's, some students will think about a goal. They want to work with the World Bank, probably want to get into the YPP program. So knowing that ahead of time, it makes it easy to now plan what are the things that the YPP program would like to see from someone. So you need to have some strong quantitative skills or strong qualitative skills. You need to be able to graduate in the top X percentile of your class. And so having those goals and having those discussions, I think is something that you will need to do. Fortunately, once you get here, you will be paired with a mentor who will have those discussions with you. The earlier you have those discussions, the better, because then you're now focused and you're moving down. And you shouldn't be worried that things will change. 2 years is a long time. It's also short, but in 2 years, things change a lot. And that's why you have a mentor who can help you stay directionally correct. The details will take care of themselves as you move forward, but working with a mentor is one thing that you will be needing to do, and the program allows you to do very effectively.
Thanks, Sandhu. I am cognizant of time. It's already 2:11. I want the participants, the prospective students, to be able to ask some questions as well. So I'm just gonna ask the panel one more question for now, and then if there's time, we can certainly go back. Eric, perhaps I can turn to you and ask you a question about working with larger research teams. I know you tend to work with groups of people. How do you include students in those teams, and what is the benefit to that student of working within that team framework?
Yeah, something interesting when I came to Duke is learning uh, how to have teams that span different levels of training. So I often have the pleasure of getting to work with teams or have faculty, because Joe described we're an institute, so we sit between, all the different schools. So faculty from different schools, and then at different levels from postdocs all the way down to undergraduates. And I teach an undergrad class as well, and get a number of really talented students as undergrads. And through programs like Bass Connections, like Asandu described, can bring all these people together at different stages. I think it's really helpful for students to be able to see what that next stage looks like. So as a master's student, what does it look like to be a doctoral student? As a doctoral student, what does it mean to have a postdoc? And then as a postdoc, what does that early faculty career look like? So just the ability to bring people together in these kind of vertical teams, I think has a real benefit to students to know what to expect, because a lot of these pieces aren't taught in the graduate program of how do you apply to the next level? What is a postdoc? And how would I be competitive for it? So these are lessons that you kind of get by being part of these teams that you wouldn't get in my class, and you wouldn't get in Liz's class necessarily, I'm assuming. So there's a lot of opportunities to be part of something like what I'm describing.
Thank you. Catherine, I know you work in quite an impressive, dynamic, large team. Could you share some thoughts on that as well?
Yeah, definitely. So we have a phrase in medicine, which it will scare you, but it's see one, do one, teach one, which essentially is someone else does it and you watch it, you do it yourself and you teach it. It's supposed to be for procedures, which God help us, right? But when you do that process, you don't finish your learning process until you teach it. And the reasoning is because you look at it a different way. You have to put words around it, and you have to know it well enough to be able to tell somebody else about it. And so the teaching process actually formalizes and finishes your learning process, I guess is the way we think about it. So when we essentially set up our teams, we partner learners from Duke as well as other countries to be able to bring something different to the table. So we have a US Duke master's student partnered with a Tanzanian master's or PhD student from one of our projects to be able to bring either language, experience, cultural context, analytical knowledge, whatever it ends up being, and that partnership train each other. And then there are postdocs or more senior levels of the team that have their ability to train on what their knowledge is and build out their individual areas of improvement. We all have areas we want to work on. And so why not be paired with someone who has a strength in that area, and you can support their areas of opportunity of improvement with an area that you have a strength. So we use peer teaching, peer mentoring, as well as senior mentoring in this group-based situation to be able to round out a team. And it builds not only the communication and the cultural understanding, but it builds leadership skills. And so a lot of our young faculty feel very comfortable mentoring because they've been doing it without knowing it for a few years. And so it builds that teaching, the mentoring, it creates relationships, which then are definitely the sort of the basis of all we do, what we do as well, right? Most of it is relationship building and team-based building. So I see the team structure as really sort of the foundation of all the work that we do.
Those are excellent points. I completely agree. Let's see if we have any prospective student questions. I don't see any in the chat, but maybe I'm missing them. If you don't want to ask in the chat, please feel free to unmute, or I think we have the ability to unmute you and ask a question if you raise your hand. Don't be shy.
I do have a question. Hi, everybody. I just want to say thank you so much for hosting this and allowing me to learn more about the program. But one of the big questions I have, just because it is a master's and I am a first generation college student. And so I don't really have a lot of experience of anyone who went through the same process I'm going through. So my question is, what tends to be the biggest hurdle for incoming students?
Liz, I think that question is definitely yours. I'm just kidding. Anybody want to take that?
I'd be happy to start unless you want to go, Liz.
Yeah, go on, please, because I think I'm debating between several things.
Yeah, so it is my favorite answer, and it's very frustrating. It depends. Remember, because I just said it depends on who you are and what your goals are. For me, it was getting back into being in a classroom, because that had been a little bit since I had done that, and I had done it in a different way, right? So it depends on where you're coming from and how you want to tackle this. I would say the biggest, those who are able to overcome whatever their barrier is, are those that are running headlong with an understanding of their goals. So regardless of what the barrier is, I think identifying your goals and setting out a strategy helps you overcome it.
Thanks, Catherine.
I could add on, Joe. I think a lot of our courses are taught in a very active style. My course is pretty similar to what Joe described. And, if you're coming from a program where, it was more common for a lecturer to stand up and tell you, over the course of an hour, what you need to know, and then you're evaluated on how well you can say that back in some form of evaluation. Takes a little bit to get used to here, that you come into class and we expect you to be ready for class, but then to participate in the learning process during the class session. So it's not just sitting there and receiving the information, it's being part of creating it. And I think for some students that takes a little bit of getting used to, a couple of weeks to settle into that.
Totally agree. That's a great question, Maddie. Other questions?
Joe, do you see Ryan's question in the chat?
Let's see, Ryan Parker. Are there opportunities for assistantships for master's students? Looking at the financial numbers can be pretty daunting. How do a lot of students typically pay for their program? Yeah, it's an expensive program, right? Duke is not a cheap school to go to. We certainly admit that. I can take a start and then I might ask others to join in. It happens in different ways, but when you come into the program your first year, one of the things you do once you kind of get your feet under you with starting classes is we do a matching program. And so we match you to a faculty advisor. And that matching typically leads to an RA-ship through your first year. And so our students have an RA-ship where they're paid to do research work with that team through that first year. And then there are also teaching assistantship opportunities, both at the Global Health Institute and otherwise at Duke for your second year. So I won't say all, and perhaps it's all, and others can correct me if I'm wrong, but certainly a large majority of our students utilize these opportunities and have income for at least a large proportion of the time they're here. Anybody want to add to that? I'm sure I missed a few details there.
I will hop in even though I'm not officially a panelist and just say I don't type fast enough for y'all, but I added something into the chat just suggesting everybody's process through the financial aid and the financial management is really individual. So I encourage you to reach out to the resources, my office, financial aid office, and we can talk through those things.
Yeah, I mean, as you're deciding whether or not Duke is the right fit for you, I certainly want to encourage you to ask all the questions that you have, right? Either here or certainly over email to us or otherwise, because we want you to make sure that you have all the information and so you know the costs and just all the logistics of coming to Duke. It's a
Would
great
now-
question. Right?
Yeah, Joe, Lisa, would now be a good time to kind of confirm the structure for the summer, the 10-week placement and financing that? That may possibly help as well, give more of a picture of
Is
financial.
this a time for that, Lisa? I'm assuming that information has been presented in other formats, but maybe not.
Well, here's my plug to come in and talk to the students in the student panels in the next couple of days as well. But there is a grant that covers the summer fieldwork requirement, and that is included in the financial support letters that people have received. And I'm happy to talk offline about it in more detail, but also, yeah, come talk to the students.
And I'm just going to add this from an international student's perspective. So when I was doing my master's, my PhD, financing is an issue before you get a visa to the US. So for everyone who needs to get a visa and you're still trying to sort out financing, I would encourage you to reach out early. Reach out to Lisa and the other office that she just mentioned. So try to start that process early, because you will need to get that sorted out before you get a visa. And the visa process also takes time. So there's not much time. So if you're thinking that you will need to get a visa, then you need to get going on the financing part, because you'll need that when you go for an interview.
Thanks, Asandu. Any other questions? Paul, can somebody unmute Paul?
Hi, I hope you're able to hear me.
Yes.
I hope you're all doing well. I'm Paul. So I wanted to find out more about the research, the field research experience. Is there sort of criteria that is there for students when choosing a specific region where they want to do their research? And the second question is for Dr. Alessandro. I hope I'm pronouncing that correctly. He mentioned of thank you. He mentioned of the Basque Connections program. When is the deadline for applying, or is there a deadline for making applications to that? Thank you.
Great, I can just answer the Basque Connections one. So the Basque Connections opens every year. So every year there's a Basque Connections fair, and you will see all the programs that were awarded that year will advertise, and then you can now apply, and there will now be a matching process where the students are matched to programs that they like. So that happens every year. You would have an opportunity to, once you get here, you will get all the information. It's currently closed, but it will open up soon for application. I think shortly after you all come in the fall, then it will open up.
Thanks, Asandu. Lisa, do you want to take the field work one? You're the expert here.
Well, I want to be mindful of everybody's time, so I'll be very quick and say that the way that students are connected to their summer opportunities, be it an organizational internship or field research, is through a structured match process that occurs actually really pretty early in your first year, usually in September. We start this process, but even before you arrive, I've started to build a list of opportunities, and they're going to be across faculty, and that means across regions, across topics, et cetera. And those opportunities, you can start looking at them even in the summer. We'll give you access to that list to start thinking about this. And then when you arrive, we'll have some conversations about focusing on what skills you want to develop and thinking about what might be a really good fit for you. But students have the opportunity to rank their interest in these opportunities, talk to the faculty leads, and then we end up with a match process. So happy to talk more about this. Shoot me an email. I will be on the student calls later, so I can also answer more questions about it. But I do want to keep an eye on our time, because I'm so grateful you all have been able to meet with us today.
Thanks, Lisa. Yeah, if you have other questions, please feel free to reach out to us. I wanted to Lisa especially, but to me too. I now want to welcome Mary Story. I know we're almost out of time, but last but definitely not least, Mary, can you please introduce yourself and say a few words if you don't mind?
Okay, I'm Mary Story. I'm a professor here at the in global health. And my research area is in nutrition, but I was also asked to answer the question that the faculty panel did on what I enjoy most about working with our students. And so I would reiterate what Osandu said. And for me, it's really mentoring, but I just wanted to quickly say why I think that's so important. So I grew up in a family of 8 children in a small Minnesota town, and I was a first-generation college student. So when I started graduate student, I really felt out of place. I lacked confidence, but I had wonderful mentoring by faculty, both for my master's degree and then when I went on for a PhD. Mentors who believed in me, listened to me, supported me, gave me guidance, and really helped me grow professionally as well as personally. And I think through that process, I really gained confidence, and they also were able to really help me develop more professional networks. And so I've had a really successful career in academics and research in child nutrition and obesity prevention, but I've always been thankful for the mentoring I received from outstanding faculty role models. And in turn, I've always aspired to be a good mentor. And so I direct our academic programs in global health, and good mentoring is such a core part of our program. It's been mentioned by the faculty here today. Our master's in global health has a much smaller number of students compared to other global health programs. So our students really have this opportunity to work closely and engage with faculty, as well as engage with each other. And so, you know, you've heard interdisciplinary throughout this, but our faculty truly come, you know, from so many different experiences, life experiences, different disciplines, but they're all really dedicated to mentoring students and helping them grow. And so students work really closely with faculty through their with their mentors for fieldwork research, as well as those that might do internships. And we also have an incredible student services team who does academic advising. And our vision at DGHI is to achieve health equity for vulnerable groups and individuals around the world, and that includes Durham and the American South. And we do this through education, research, and partnership. And if you look at our website, we list our vision, but also the mission statements. And I was looking at it today and I thought this is so right, because the first one is prepare global health leaders through world-leading interdisciplinary education. So educating students is really so central to our vision and mission here at DGHI. I really want to thank you for joining us today. I hope that you'll come to Duke and that we'll have an opportunity to meet you in the fall. If you have any questions for me or want to talk, please reach out to me. You can get my email on the web. And we hope that you'll join us for one of the upcoming virtual panel sessions with our current Duke MS Global Health students. And those dates are March 24th and 29th. You can get to know your future classmates and learn more about the student experience here. And registration for these events can be found on the Admitted Students webpage. So I'd like to thank you again for being here today and have a wonderful rest of your day.
Thanks so much, Mary. Thanks, everybody.
Thanks, everyone.
Take care.
Hi, everyone. Thanks.
Thank you.